I'm Mark Hanrahan live at the Spokane Arena tonight, where in just a matter of hours, people will start getting their vaccines. We'll have everything you need to know about the mass vaccination clinic.
We've got team coverage tonight on that mass vaccination side, and we are answering your questions, tracking down everything you need to know, from who's eligible to how you can schedule your appointment.
We're here at the Kennewick mass vaccination site, where yesterday this entire parking lot was filled with people waiting to get the vaccine. Today it's a much shorter line. We'll tell you why.
And we're tracking snow just in time for your morning commute. Your forecast details are next. Good evening, everyone. Thanks for joining us tonight on KREM 2 News at 5. I'm Tom Sherry.
Welcome, everyone. I'm Whitney Ward.
And welcome, everyone. I'm Mark Hanrahan live at the Spokane Arena tonight, where in just a matter of hours, they will start vaccinating people here in the Inland Northwest at the Spokane Arena. So today, final preparations are underway right here. The National Guard is on site. They're helping set things up inside and outside to help manage traffic flow at the arena when things get underway starting at 9 a.m. tomorrow morning. Chaz Health is running operations in terms of distributing the vaccine. They're hoping to administer about 500 shots tomorrow, and they also want to point out it's important to remember their COVID-19 testing site in the arena parking lot that will continue alongside of the vaccination. So the Spokane Regional Health District confirmed yesterday they received the first shipment of 3,000 Moderna vaccines for this site. There was growing concern around the state after several other regions in Washington saw their computer systems or software crash due to an influx of people signing up to get the vaccine. At the Benton County Fairgrounds in Kennewick, organizers say they were forced to hand out vaccines on a first-come, first-served basis due to an error with their scheduling software. In Spokane, Chaz Health officials say they have worked to make sure their systems are stable to prevent any kind of crash or chaos in the registration process.
We have been working with our IT departments and our third-party vendors to ensure that our systems are going to be up and operational. We don't anticipate any IT issues. If we did, there are contingency plans. That would not include a walk-up, however.
Officials at the arena will be giving out doses of Moderna vaccine, but there is a chance down the line the Pfizer vaccine could also be handed out here. But Chaz Health tells us there is a plan in place to make sure people don't get their vaccines mixed up. So as of right now, the mass vaccination clinic in Spokane is only for Tier 1 of Phase 1B, which means anyone 65 and older. It also includes people who are 50 and older if they live in a multi-generational household. We should mention the other tiers in Phase 1B are not eligible right now. They will be at a later time. Of course, individuals in both tiers of 1A are eligible to get vaccinated at the arena if they have already not done so. So Washington State, meantime, has rolled out a more robust version of their Phase Finder online tool to help you determine if you're eligible and when you are eligible. So the survey now asks questions related to Phase 1B. Again, that's mostly dealing with seniors and people in high-risk settings. People can check boxes to indicate if they have cancer, diabetes, a heart condition, or a weakened immune system, or if they're an essential worker like an educator, a grocery store employee, or public transit worker. If you are eligible to receive the vaccine, you can enter your name and contact information to get a confirmation message to show to a vaccine provider, like here at the arena, to demonstrate your eligibility. If you're not eligible, you can still enter your contact information to be alerted when it is your turn to get the vaccine. Now, there are some factors out there for some folks who may discourage them from wanting to get the vaccine even if they are eligible. So here are some things to consider, especially if that's the case for you. So if you experience an immediate allergic reaction to any vaccine, injected medication, you should get clearance from an allergist before getting the vaccine at the centralized vaccination site. You should not receive the COVID-19 vaccine if you've received any vaccine within the past 14 days. Organizers ask that you schedule your vaccine appointment outside that 14-day window. Online scheduling of COVID-19 vaccine appointments, they have to be made online before coming down here to the arena. You can't just show up tomorrow morning and expect to get a shot. You have to do that tomorrow morning. Again, that opens up at 9 a.m. It's being administered through Chaz Health, and it's important to note there's no wait list either. Health officials recommend that if you're eligible, you check with your primary health provider To see if the vaccination is being offered there, you can visit chas.org/COVID vaccine, again, starting at 9 a.m. tomorrow to schedule your appointment. You should bring a copy or a screenshot of your DOH Department of Health Phase Finder tool proving your eligibility to receive a vaccine, a photo ID, and an insurance card if you have one. If you don't have internet access, call the Washington Department of Health COVID helpline. At that number right there on your screen, there's also an option available in Spanish. The phone resource, by the way, will be live on Friday, January 29th. Meantime, in Tri-Cities, we mentioned, that's another one of the mass vaccination sites. They have a different kind of procedure down there. Theirs is set up as a drive-through vaccination site, but they had some administrative issues down there today, which forced them to kind of switch gears a bit and offer the vaccine in kind of a first-come, first-served basis. So our Casey Decker made the trip to the Tri-Cities today and has more on how day 2 went down there.
The drive-through line might look pretty long right now, but it's really only taking up a couple of lanes. Meanwhile, I'm told yesterday, all of these lanes all the way back to the street were completely filled with cars. So today they changed things up a little bit in terms of how people are being processed. And even though there's still been some challenges, all in all, things are going much more smoothly.
You're going to fill in your own name, date of birth, and all that good stuff.
On the day this site opened, the online appointment system crashed, so organizers switched to a first-come, first-served system.
Yesterday was confusing.
We knew it was going to create a logistic nightmare, everybody being out here at 3 a.m. in the morning, but we knew we could handle it.
Cars waited in line for hours.
Gonna be a little pinch.
But they still administered roughly 500 vaccines. Still, the state said that on day 2, they needed to stick with an appointment-based system so they could accurately track who was getting vaccinated.
It's been confusing. Of course, first thing, we still had a lot of people out there that thought it was first come, first serve. So we had to get the information out to them as they drove up. Of course, that makes anybody disgruntled.
All right, and little pinch.
There were still some challenges with the appointment system today, but on site, things were moving quite quickly, roughly 100 shots per hour.
Setup you have here was very efficient, and we moved through the line fairly quickly.
Oh, wonderful, wonderful. I expected it to be a lot longer. There was some confusion with the scheduling, not scheduling, back scheduling, but hey, you expect those kind of things, and I think everybody's just done a great job.
Is it okay if I open the door?
It is wonderful.
Even though the appointments do have specific times, people were allowed in if they were early, as long as their appointment was for today. The team has 3,500 vaccines for the week and just wants to get them in arms as quickly as possible. Today, they were able to fill roughly 700 appointments. Showing up early may mean a little bit of a wait, but the people we talked to said that was a small price to pay for the comfort of being vaccinated.
Huge relief. Our kids are going to be thrilled. And now we just wait for the next one.
So the plan is to stick with this appointment-based system for the foreseeable future. They'll open up again here tomorrow morning. Reporting in Kennewick, Casey Decker, Crime 2 News.
Meantime, back here at the Spokane Arena at 5:30, Chas Health is expecting to give us a tour of the operations inside the arena so we can show you what to expect when you get that appointment and you show up here. Again, that's happening at 5:30, so we'll bring you more on that on Creme 2 News at 6. In the meantime, if you have any questions about the vaccine, the process, or the arena setup right here, just text us your questions to 509-448-2000, and we are working to answer as many of those questions as possible. Tom and Whitney, back to you.
All right, Mark, great information. Thank you
bet.
very much. Also, we want to turn our attention now to Tom Sherry as we talk about conditions tomorrow. We know that there is snow coming. It may be very lightly falling depending on where you're at tonight, but certainly there's going to be more snow in the overnight hours as we go into the morning, perhaps right when people are trying to get to work or maybe to that mass vaccine clinic.
Yeah, right now the computer models are forecasting most of the snow, at least in the Spokane area, is going to fall just in time for your morning commute between, say, like 6 in the morning to up to about 9 in the morning. So we have a winter storm warning in effect across portions of the east slopes of the Cascades, including the towns of Chelan and Wenatchee. 3 to 5 inches of snow possible there. Everywhere you see shaded in blue, that's a winter weather advisory tomorrow till 3 in the afternoon. This is 1 to 3 inches of snow. That does not include the Spokane and Coeur d'Alene area. We are not under an advisory, but we are expecting snow. It's cold out there right now, folks. We're at 26 degrees. Wind is out of the east-northeast at 8 miles per hour, as you can see. And again, still some of that snow on some of the streets downtown, especially the side roads. Those roads are in pretty slippery condition. The side roads, very, very icy. So we think we could get 1 to 2 inches of snow in Spokane, less than an inch over in Coeur d'Alene, 2 to 3 in Sandpoint. Hardest hit areas, Wenatchee and Chelan, 4 to 6 inches of snow. Much less snow as you head farther down into the Palouse. The Moscow Pullman area may get less than an inch of snow. Overnight low of about 25 tonight. We'll see a high tomorrow of 37, so could be a heavy snow towards the middle of the day. But again, I think most of our snow falls in the morning hours. Here's a look at your weekend forecast. 37 on Saturday, a mixture of rain and snow on Sunday as we look for a daytime high Sunday of 40 degrees. Whitney?
All right, Tom, thank you so much. Let's take a look at the numbers now. The Washington Regional Health District is reporting 235 new coronavirus cases today. There were also 4 new deaths just since yesterday. Currently, 109 people with COVID are hospitalized. Meantime, over in North Idaho, Panhandle Health is reporting 70 new COVID cases today, although no new deaths. Currently, 49 people are hospitalized in the Panhandle due to the coronavirus. Today, Governor Jay Inslee offered an update on where the state stands in its vaccination process. So still ahead tonight, we're bringing you the newest information straight from Olympia. But first, we want to send things back to Mark Hanrahan out at the Spokane Arena with more on what you can expect right after the break. Mark?
Yes, good evening, Whitney. In just a matter of hours, the mass vaccination clinic here at the arena will get underway. They're hoping to vaccinate 500 people tomorrow. Everything you need to know coming up.